Why do they do safe supply? They say they want to be able to create safe access to drugs so that you can keep people long enough. Why? So they can get into recovery. And if the whole purpose is to get people to a point in recovery, why not start there? And that's what we've done.
Here's the voice of government, informed by evidence and the data, telling everybody right now that you've been lied to for the last 25, 30 years. And what they started off as a good intention around harm reduction, when you have drug consumption sites in every street corner and you have safe supply or unsafe supply, it becomes harm production and not harm reduction. And we need to say that loudly and clearly. So you're handing out drugs to drug addicts to deal with an addiction crisis.
Yeah.
I mean, it doesn't take a PhD. Is there something so silly you have to be a Liberal MP to believe them?
Yeah.
And this is in that category.
I'm Associate for Rebel News. If you're happy and willing to leave a person, a human being trapped in a vicious cycle of addiction with no hope of escape, or worse still, if you are actively providing them with drugs, you'd be considered an enabler at best. And at worst, you might be considered a bad person, a monster, or worst of all, a progressive. That's right. Somehow, the left's version of compassion under leaders like Prime Minister Justin Trudeau or BC Premier David Eby consists of letting people live in absolute squalor in dilapidated tent cities and then legalizing and providing them with free, addictive, deadly drugs. And then the sickest twist of all, pretending that they are safe, almost as though keeping these folks in that state is part of the plan. Well, part of our Western heritage, as we are celebrating the Stampede in Calgary right now, consists of taking care of our neighbors, no matter how hard that may be. So Ottawa's give them drugs and let them live in tents approach, well, it doesn't quite sit right with folks out west. Fortunately, in a breath of fresh air, in the form of common sense and actual compassion, Alberta, under the leadership of Premier Danielle Smith, has rejected the woke approach to this issue, and instead, as shocking as it may sound, is actually putting in the work to help people recover from addiction and to help people reclaim their lives. Rebel News was fortunate to be invited out to the Alberta Adolescent Recovery Centre's Stampede Breakfast to learn more about the work they're doing and their efforts to help people free themselves from addiction.
I went through treatment here in 2020, and then I spent about a year in my treatment due to my own challenges. But then, I graduated 2021 and started working here 2022 and have been working here ever since.
My son developed a drug and alcohol addiction, and it was getting really serious. We couldn't stop him and he couldn't stop. And I found ARC because he was unwilling to seek treatment. He wouldn't go to the hospital. He wouldn't do counseling. He wouldn't do anything, and addiction runs in our family. And so I've seen, how it ends up. And I found ARC, and now he's doing great.
In regards to safe supply, myself as an addict, I could never use safely. I was using harder drugs that just you could not use them safely, or even if you used a little bit, it's still crystal meth, or it's still heroin, or whatever, right? I've never heard somebody who uses heroin just on the weekends, right? And with ARC in specific, I think for myself, being told hey, your life is unhinged, your drug use is unhinged, and you're here because we care about you, and it is a form of compassionate intervention, right? Where you need to stop and you need to look at your life, and you're not the person who can only use crystal meth on weekends, right? Yeah, so that was really important to me.
When someone is deep in their addiction, they're too sick to be able to see that they're sick, first of all, and they're unwilling to get treatment, and they're unable to make rational decisions. And, the government steps in for people who have other mental diagnoses, schizophrenia, bipolar, and we have the Mental Health Act of Alberta where they can be detained and treated against their will. But for addiction, it's, if you don't want help, well, okay, wait till you ask for help. Well, most of them never get to that point. So we must intervene, especially children. They're not able to make rational decisions for themselves when they're this sick. So that's why ARC is so important.
Long before, this Danielle Smith introduced compassionate intervention, like I did believe. I thought I was kind of a lone wolf in that way, or ARC was a lone wolf in the way where compassionate intervention was being used. But now that it's used for adults and everything, I think it's amazing, just because as an addict, you're not able to really make those choices for yourself sometimes. So somebody else has to make them for you ultimately, which I think is saving a bunch of lives, or will be saving a bunch of lives.
How's your son doing now?
He's doing amazing now. Yeah, he's 19. He was 17 when he was in ARC. He was in for a year, but he turned 18 while he was in ARC, and he wanted to stay because by that time his brain was cleared enough and he was getting the treatment. Yeah. And so, yeah, he's doing really well now. I mean, it's, life is rocky. It's never going to be perfect, but the community that he has now, the recovery community, he has meetings, he has a sponsor, he knows what he has. He knows the disease that he has. Yeah. So
would you say it saved his life? Absolutely.
Oh yeah, and he says that all the time. Yeah. He says all the time, it saved my life, it saved my life, thank you. He was mad at me at the time. Yeah. Oh yeah, but within a few months, he was like, oh yeah, I need to be here.
I've been active with ARC since it was founded. And why? Because a guy named Dean Vause was a classmate of mine at university. So friendship goes way back. The cause is important. A client of ours said, when I was at a brokerage firm, said, you should support ARC. And I was going, oh, ARC? I didn't know Vauser had founded it. It was a year earlier. Wow. So anyway, I've been actively supporting Vauser, and the businesses I'm involved with have supported him since 30 years. And gosh, I love this guy.
We know that kids are dying out there and it's ugly, and I've been here open 32 years, and we've always focused on the kids, and you see the miracles out there. I got a ton of miracles that are going out in this community. Now they're having their own kids and having their own families, and they're sober. But we need to validate this program, not just on anecdotal and kids that are carrying the message. So I had to go out and do the academic work. And the academic work started with my doctoral work. In '94, we published, I had 5 incredible academics validate this program or build the program. 2004, we did the Dr. Patton report, which said over the majority of our kids are sober, clean and sober. In fact, 8 out of 10 kids that start this program finish it, which is the most important statistic in long-term recovery. They complete the program. Then I brought in Dr. Rhea, Dr. Winters from University of Maryland. Yeah. They concurred with the same success rate as Patton, same retention rate. Over 8 out of 10 kids that start the program finish the program. Yeah. And more importantly, the outcome studies. There's not many outcome studies on youth, but academically, I had to go out of the province, out of the country, to validate what we're doing every day. We know we're successful. We know those kids can succeed. That's my job every day. Yeah. I tell that kid, the new kid in there this week, my job is for you to succeed. Then you got the majority of your clients out there living life. I got guys with 30 years recovery, 25 recovery, 5. To them, it's like, yikes. So that's hope in human form. So the academic work is so important. And now we're doing a study right now on the compassionate intervention of how we treat these kids. So we got to continue to do the academic work. The UCP have supported us. Danielle Smith and Marshall and those guys have been behind us. It's incredible. So we're extremely grateful because it allows us to do the work that we're doing every day, 364, 24/7, every day in here, but also show the academic work, because they're going to be, anything you do, you have to be credible. Right. We're credible on our results, our outcome studies, and what we're doing. It's not credible on what we're promised to do. We've been doing it for 32 years.
What really bothers me is that other provinces haven't got their mind around it. What we're showing here in terms of leadership, and I wish I could name all the ministers that were just here. Tyler Chandra's just leaving. He's an important part of this. Yeah. But the way that Danielle Smith got up and articulated her support and belief for the fact that we're not making drugs legal, we're not making drugs for people to take while they're lying on the streets of our city, we're helping them get better. And that's a core message here. And I think other provinces are learning from what Alberta's doing. I really believe that.
Usually they've tried many different avenues to get here. Yeah. There's no easier, softer way. This is a intense, ugly disease that's trying to kill our kids, destroys families. They come in here shattered. Yeah. And I think that's the part. We say here, the only easy day is yesterday.
Yeah.
Because we were in here all week working with those new kids on the front row. That's why we're still here 32 years later.
Yeah.
That's why we have a success rate that we have. And so the hardest thing why I'm still here, and I'm on the November of my career, is there's more lives to save.
Yeah.
And we know that, but that's what's on the line. The most painful thing, and I've said this before, is losing a child. There is nothing more painful than losing a child. So we're taking that risk with the solution.
Yeah.
So we're grateful for the support. But my solution's in those families that get better and those kids that get better.
Yeah.
They carry the message.
Yeah.
So there's hope.
Yeah.
So that's over 32 years. We've come a long way. Never forgetting that kid today that's sitting in the first chair at ARC is the most important.
The timing is great in terms of it being during Stampede when we get together and we hear the yahoos. But far more importantly, this guy's working 365.
Yeah.
I don't know. He doesn't get a day off.
No.
He doesn't get a day off.
Yeah.
And quite frankly, neither does the Premier.
This sort of safe supply mentality out there, if you could talk on that.
Well, for us and our kids and our clientele, there's no safe usage. That's a death sentence for our kids.
Mm-hmm.
To tell them to cut down, it'll destroy. They know that, but that's their only solution in the end. So when you step into that kid, their only solution is the drugs and alcohol, and you tell them, well, just cut down. They can't.
This is one of the fundamental principles of the West, and that is community, taking care of each other, not leaving someone behind. You bring them along with you, and that's really what this program is about. So it is an honor to be here today. I'm honored to have ARC as part of Calgary Midnapore Adam.
Calgary, I think that we got a great place here that people really care about their neighbors. There's 1.5 million people here, but it doesn't feel like that big of a city. It feels like a city where people care about their neighbors. And this Stampede, coming together for 10 days and giving that Western hospitality, I think that's really what it's all about.
Well, I just know that so many members of our government believe in compassionate conservatism. We know that there was a real lack of beds and supports and services that so many Albertans needed to get well, to begin that cycle of healing, help break the generational trauma. So really appreciate the leadership of Premier Smith as well as Minister Williams and the rest of our government and the approach we've been making, because we know it's going to make a difference in the lives of Albertans and truly make a difference for so many families right across the entire province.
Is the federal or potential future federal government or Pierre Poilievre looking at a similar model for Canada?
Well, you know what? We are very committed to a recovery-oriented system of care, giving people the hope so they can have the off-ramps to find their way to sobriety. And frankly, what Alberta's been doing has been leading the way. We're also seeing positive movements in Saskatchewan, New Brunswick, and so you know what? We're going to continue pushing forward the message of hope.
The place behind us here has the right word in it, recovery. This is about actually seeing the dignity of individuals. And I don't think that the left sees that. I don't think that they really recognize that an individual is not living when they're in addiction. They are feeling completely hopeless. You need to give them some hope. And that's what I think that the recovery concept, the recovery strategy that our government is rolling out is all about. And to tell you the truth, I think that's the Christian thing to do.
It's humanity. This is about caring for people that are vulnerable in our society. This is about taking people and believing that they have capacity and capability and value in society. And you just have to walk around here and meet some of the alumni and hear how this has changed their life. You go, whether I've been in New Brunswick, in Saskatchewan, in Alberta, and BC, you meet people that have recovered from addiction and the lives they now have, it's worth it.
So when I start talking with families that are entering the treatment systems and programs, the stories that I'm getting back, the message that I'm getting back is, for the first time ever, they have hope. They know that there's an actual path forward to them, for them to begin healing, and facilities like ARC down here in Calgary, as well as all the other programs and services that we're funding right across the entire province. I mean, to look at the eyes of those that are individuals that are saying we had nowhere else to go, and now there's a path forward for us. So for myself, that's the truest and the biggest victory I know in this, but we have a long ways to go, but the steps that our government has made up to this point have just been incredible. Minister Williams is taking the lead on this, and I've been very appreciative of his leadership on this file. At no other point in Alberta's history has there been such an emphasis on additional beds, additional resources to help people when they truly need help the most. So the fact that Minister Williams is really just digging into this file, along with the support of the rest of our caucus, like I said, we know it's going to make a massive difference for just so many families right across the province that are really looking for a place to begin that healing process.
Fundamentally, it's this notion as Albertans and as Canadians that we have compassion and care for our fellow neighbor, for our family member, for the good and welfare of our community. Yeah. I mean, this is about compassion, respecting the dignity of every single Albertan. It's also about a sense of public safety and community building. I mean, what the Liberals and the NDP have been offering to Canadians for the last, let's say, 2.5, 3 decades has been this horrible choice, this dichotomy that says you either get to try and be compassionate or you get safe communities. I mean, who does that in leadership? Yeah. And who says the reason it hasn't worked is because we need to double down and do more and more and more, which is why they've gotten us to this insane idea of unsafe supply with government paid for high-powered opioids distributed en masse into our communities. So you're handing out drugs to drug addicts to deal with an addiction crisis. Yeah. I mean, it doesn't take a PhD. Is there something so silly you have to be a Liberal MP to believe them? Yeah. And this is in that category. Yeah. So Alberta's taking a different approach. I'm a healthcare minister, Minister of Mental Health and Addiction. And so in healthcare, the purpose of healthcare is to heal people. Yeah. And so we're giving them recovery as an option. Every Albertan deserves that opportunity. Every Canadian does too, which is why I can't wait to see this federal government replaced sooner than later. And I think should do the right thing and call an election. But in the meantime, Alberta will do exactly what we're elected to do, which is care for Albertans with compassion, respecting their dignity, giving them an opportunity at recovery, because addiction run its course. And you can ask the folks who have gone through this place here at ARC if you want to, those young children and families. Addiction has one of two ends. It either ends in pain, misery, and given enough time, death, or it ends in treatment, recovery, and a second lease on life. Now that's a true dichotomy, and Alberta's putting our eggs in the basket of helping people heal in recovery.
I know people think of Stampede as a big party, and that's part of it, but it's also a very family-friendly event, and I was so pleased yesterday to be at Sober Stampede, so it's the first event of its kind, and I hope it happens year after year, where people who want to be able to enjoy the festivities without the alcohol and the drugs are able to do that. And I make the Alberta Adolescent Recovery Centre a regular stop on my Stampede circuit. They really are inspirational in how we're applying the kind of approach that they've pioneered for decades to cover more people, more Albertans and adults, because there has always been this idea that you could get into a 28-day recovery program and then you're off, and that's not really the reality for most people. Most people have to try a couple of times, and they need to have the peer support. They need to know that somebody who's been there at the depths of despair has found a pathway to recovery, and that's really inspirational. So that's part of the model that we're creating, so that people can get immediate access to a virtual opioid dependency program to get replacement for opioids, then move on to support, whether it's in a corrections facility, because we've got support in corrections facilities for detox and recovery, and then on to the recovery community where up to a year they can get reconnected with their families. And we're really hopeful with our first 2 of 11 being in operation that we're going to make a massive impact on the number of people who are suffering from addiction.
All of society for the last 25, 30 years in Canada, and maybe even the whole West, has been hoodwinked by the so-called experts that say that they have peer-reviewed studies that if you hand out drugs to drug addicts, it's going to deal with the addiction crisis and make it better and not worse. And Alberta says, no, the evidence is actually not that. If you look at the Stanford Lancet Commission and Dr. Keith Humphreys, who's a presidential advisor to 3 presidents on both sides of the aisle, if you look at the best evidence internationally when it comes to it, recovery works. And so here's the voice of government, informed by evidence and the data, telling everybody right now that you've been lied to for the last 25, 30 years. And what they started off as a good intention around harm reduction, when you have drug consumption sites on every street corner and you have safe supply or unsafe supply, it becomes harm production and not harm reduction. And we need to say that loudly and clearly, because there are very good, well-intentioned Albertans that say, of course I trust my physician. Of course I want to trust the experts. I'm somebody of reason. I'm somebody that wants to be based in the facts. And they've been told this lie. And I will be honest, it's your colleagues in the media that have perpetuated much of it, and the mainstream media that have been absolutely devastating to the health and welfare of not only society, society writ large, but they also play a part in the individual damage that happens and carnage of addiction that destroys a soul and a family and often even the life itself.
I think one of the things that I'm hoping to have as a breakthrough is it depends what foot you lead with. I mean, we do the full range of supports for people, but we lead with recovery because we want to lead with an answer that leads to a healthy, independent life. And others want to lead with a different foot. But I can tell you, when you get down to the bottom of it, this idea of safe supply, first of all, we just don't agree there's such a thing as a safe supply of heroin or fentanyl or crystal meth. But why do they do safe supply? They say they want to be able to create safe access to drugs so that you can keep people long enough. Why? So they can get into recovery. And if the whole purpose is to get people to a point in recovery, why not start there? And that's what we've done. We've reversed it. And I think that what we will show over time as we build out our recovery communities, that this is the right choice. This is the compassionate choice. And this is the kind of choice that restores people's free agency so that they can go on to reconnect with family, reconnect with community, and be able to live full and productive lives. The number of babies that are there from people who went through the program years ago, that is the testament to why it is we're doing what we're doing. It's for the next generation. It's so that moms and dads can see their kids grow up healthfully and have kids of their own one day. And that is, and you see this in spades here. It is just such an example of what happens 10 or 20 years out when you've got somebody on the path to sobriety.
People struggling with addiction don't need safe supply. There's no such thing as safe supply. What they need is help and recovery. And when they don't receive that, we see the consequences in the form of dilapidated tent cities, in the form of widespread addiction and drug use. Things just get worse and worse. And you can see it in any major city, in any downtown core. It's happening somewhere near you. And that's why we need elected officials who will actually take a stand, work to make things right and ameliorate things, not surrender society to total chaos. If you agree, sign our petition at fixourcities.com.